There we are. Hello. Welcome to UC Davis Health's very first Facebook Live conversation. I'm Pamela Wu, Director of Media Relations and Communications for UC Davis Health. September is Women in Medicine Month, when we celebrate the unique contributions of women doctors. Here at UC Davis, women are as likely to be in labs as they are in clinics, so we celebrate women in science as well. It has been nearly 170 years since the first woman graduated from medical school in the United States. Today, nearly one half of the country's medical workforce is female, and just under 30% of the scientific workforce is female. Joining me today to discuss women in medicine are Doctors Melissa Bauman and Shannon Suo. Both are faculty here at UC Davis Health. Dr. Bauman is an autism researcher at the UC Davis Mind Institute, and Dr. Suo is a family medicine and psychiatry physician. Welcome, and thank you both for joining us.
Thank you.
And as we chat, please be sure, as you watch us here on Facebook Live, to ask questions by typing them in the Facebook comments, and we'll try to answer as many of them as we can. Dr. Bauman, I'd like to start with you. What attracted you to the field of neuroscience and autism in particular, and why did you choose UC Davis as the place for your career?
Well, I was first introduced to neuroscience as an undergraduate. I was debating between majoring in biology or psychology, so neuroscience was the natural combination of the two. I remember one of our assignments was to write a paper about a brain disorder that we found interesting, and I picked autism. And this was back in the 1990s, and I was very surprised how little we knew about autism, what caused it, what treatments were most effective. And that really sparked a lifelong interest in understanding autism. So when I applied to graduate school at UC Davis, they were beginning the process of building the UC Davis Mind Institute, and I knew that that's something that I wanted to be a part of. And I'm very fortunate 20 years later to be a faculty member at the UC Davis Mind Institute.
Wonderful. Dr. Suo, a career in either family medicine or psychiatry can be challenging, yet you do both. How did you settle upon your career path?
Well, I knew from high school that I wanted to be a physician. I fell in love with my first frog dissection. My high school friend still talks about the fact that she just let me do everything and she got an A. So I knew very early that I wanted to be a doctor. And when it came time to choose some specialties in medical school, I really enjoyed family medicine. It was something that encompassed a lot of things. It allowed me to take care of people from the cradle to the grave. And the thing that I noticed was that a lot of the family physicians that I worked with struggled with people who had very real problems that interfered with their lives but were psychiatric in nature. And that was the one thing that I saw very commonly, but the family physicians didn't know how to deal with it. So when I learned about the combination of family medicine and psychiatry, I knew that that was the specialty for me. I was fortunate enough to be at a medical school that had a residency in that, so I learned about it, and I wanted to return to Sacramento, and UC Davis had that residency program, so it was perfect for me.
I love that for the both of you, your specialties were like callings. And so that leads me to ask, how satisfied are you with your chosen career paths? I'll start with you.
Great question. I love what I do. I'm a basic researcher, and I love the process of scientific discovery. Autism ended up being a perfect career choice because there's so much work that's needed. And working at the Mind Institute, we see every day families who are struggling with autism and other neurodevelopmental disorders. Over the years, my program of research has really focused on the prenatal environment and how changes in the maternal immune system may increase the risk of having a child with autism or other neurodevelopmental disorders. The pace of research is slow, but I feel like we're making progress. So overall, I would say I'm very satisfied.
Great. Dr. Suo?
I love what I do. Again, I loved everything, and so I think the hardest challenge I have is trying to figure out what to limit myself to. I have finite time, I have finite me, so I try to focus on the things that bring me joy. And so the things that I've discovered, especially since coming to UC Davis, are that educating medical students and residents, as well as the patient care, is what I really enjoy doing. And I find that by teaching medical students and residents what I really like, they learn, they explore new horizons, and they in turn provide excellent care to patients. So I feel like it's an extension of what I started out to do, which is just to help people, what everybody says when they get into medical school. and I'm sending other people out to do great work.
That's great. Now, what are some of the challenges that the two of you have faced along the way? Medical school is challenging, science, medicine, they're very challenging fields. But what challenges are there that you've encountered that you feel might be unique to women?
That's a great question. And I just started today teaching my annual fall class on women in science. I teach this on the main campus to the freshmen. And so we start off with a historical perspective, and we talk about the challenges that women faced just in obtaining an education in science and medicine. Our students are always surprised to find out within the last century, women weren't allowed to take those classes. Obviously, I've never experienced anything like that, but I will say as my career has progressed, there have been challenges, especially in work-life balance. So, and I think that we're starting to realize that these work-life balance challenges are not unique to women. Young men also are experiencing these challenges, and I know it's something Shannon and I have talked a lot about. But finding a way to have both a career and a family is very challenging.
What about you, Dr. Suo?
I think one of the things that I find the most challenging, not only for women, but also for especially underrepresented groups in medicine, is the unconscious bias that we all have. And this is throughout society, it's part of culture, but it leads us to jump to conclusions or make assumptions about people that we don't even realize. That's why it's unconscious. And so many of those things are ingrained in our culture that we have to make a concerted effort to overcome them. We were talking before the interview about this idea of kin keeping, that women will engage in the familial relationships. They will take responsibility for keeping track of birthdays, buying presents for people, sending thank you notes. And it's not that men can't do those things,
Right.
but they're typically not expected to.
Right.
And nor are they faulted if they don't do them. But yet, women take this on, we hold on to it, we exhaust ourselves with doing
It
it.
takes a
on
lot of
top.
psychic energy to take care of all these little things.
Yeah. So those are the things that women add to a career that throw the balance off a little bit. But it's something that is ingrained in society and therefore becomes harder to change.
I have a quick follow-up question
Sure.
for you about the class that you're teaching. Freshmen, you said, on the undergraduate campus. Is it primarily women in your class?
It is this year. So they're small classes. They're capped at 15. I've co-taught this with my colleague Cindy Schumann for the last 7 years. Usually we have 1 or 2 male students who sign up, and some of our best students over the years have been the young men. And I would encourage more young men to sign up for this type of class because that's where we need to start and have these conversations very early.
Absolutely, and to have those male allies
Absolutely.
as well. Are there resources at UC Davis that have helped in your careers and helped to balance, say, your work with your lives at home, which you've both mentioned?
I will, as the incoming director for our Women in Medicine and Health Sciences program here at UC Davis, we go by WIMS.
Okay.
I will make a plug for our WIMS program.
Yeah, I'd love to know what it is.
We have a vibrant program that was co-founded by Dr. Lydia Howell and Amparo Villablanca. The goal of our WIMS program is to support women's careers in academic medicine. So broadly defined, we want to support our physicians, our basic researchers, individuals at the nursing school. So it's a great opportunity for women to come together and network. So in addition to the formal mentoring that takes place through WIMS, you'll also find an opportunity to meet new female faculty. And I think that peer support is really one of the most important aspects in order to find that balance, because there's not a one-size-fits-all. So you need to find the people that you connect to and can share those concerns and get advice from somebody that you trust.
Your thoughts on resources to help women in their careers and also to balance with life at home?
Yeah. So I'm one of the recipients of a benefit that WIMS provides, which is the WIMS mentee role. So for the rest of this year and next year, I'm the WIMS mentee. I receive direct mentorship from Dr. Bauman, Dr. Villablanca, and I also have a whole committee of mentors that I work with. I'm actually working on a project now to try and disseminate information about WIMS and help work with other departments and schools within the health system to create a better environment for women in medicine and health science. Additionally, in psychiatry, we have a group called SWAP, which is the Society for Women in Academic Psychiatry. And so Tara Needham, who's a psychologist in our department, and I co-chair that group. We've been doing that for the past, oh my gosh, it's been 7 years now. And so we also find that a source of support within our own department. And I think I'd be remiss if I didn't mention that mentors are really important too, whether the formal ones or informal ones. And certainly among those, the men count just as equally as the women, because of course there's more male mentors out there.
Yeah.
And really the sponsorship that they can provide in helping women along their careers is invaluable.
Okay, so you've talked about WIMS and was it SWAP? Okay, we have a lot of acronyms around here. What else can be done to support women in medicine and science, whether it's here or anywhere?
Well, in addition to the institutional support and the formal programs, I think it's important for everyone to give back. So the example would be teaching this freshman seminar. I really value working with young women who are considering careers in science or medicine, and there are things I wish I would have known. And so hopefully they can learn from some of my experiences, and we can improve the climate for women in science and medicine for the next generation. So reaching out to the next generation, I think, is a really powerful tool.
What else would you like to see done?
I think the women banding together, whether it be formally or informally, is really helpful. Once you have enough people, critical mass, then you can really achieve a lot of different things and provide support to each other in a way that an individual just doesn't have. So again, whether formally or informally, finding those people that you mesh well with and have things in common and can learn from.
Yeah. So I'd like to turn to a couple of our viewer questions now. And the first one is actually a great follow-up to something that you mentioned, which is what I wish I had known when I had gone to med school. And this question comes from Sean Kramer. What advice might you give to a young woman who wants to practice medicine and also knows that she wants a family?
Well, I think I will let Shannon answer the
Okay.
MD question, if that's all right.
So you have to stick with it. It's a tough road. There are very personal decisions that you need to make regarding when you start a family. You have to be very cognizant of the choices that you make along with your partner, because your partner is going to have to share in those responsibilities. As we discussed, there's the kin keeping, there's the just biological things that you have to do in terms of having a child, and then there's also going to be the work or the studies. So people make very conscious choices, hopefully, in order to be successful. For me personally, I waited until after I was done with residency, a 5-year residency in combined psychiatry and family medicine that's normally 7 years. Is a lot.
Yeah.
So I am blown away by my residents who are able to have a child during that residency and extend by maybe just a few weeks their training. But they made a very deliberate choice.
Yeah.
They worked with their partners and they were able to do it, and it's tiring.
Yeah.
But they feel like it's worth it, and I certainly see their families thriving, their careers thriving, so I would agree.
And it takes a team.
Yes.
Yeah. What do you wish you had known before embarking on your PhD program?
Just to follow up on some of Shannon's advice, I think it's important for our young men and women to know that there's not a one-size-fits-all.
Right.
So science is changing. The way we do science is changing rapidly. We talk now about interdisciplinary research and team science, and it's much more collaborative. Within that space, there has to be some flexibility for career trajectories. And this is especially true for women, because if you do choose to have children, that will take place at a time in your career where you're under tremendous pressure to produce your scientific achievements. So I would like the young women to know that to make their own path, you don't have to follow every recommendation. And sometimes I've received advice that I'm really glad I didn't take. I chose to have my children relatively early, at least on a science PhD timescale. I had my daughter when I was a postdoc and my son the first year that I was on faculty. May not have been the best career timing, but it was the best time for our family. So I would advise people to make their own path and make their own decisions.
We have another question from Michelle. Your thoughts on good strategies to attract and retain women in leadership roles in medicine and science? Let's talk about women in leadership roles.
Yeah, that's an important area. So overall, nationally, we have 38% of med school faculty are women. That sounds pretty good. As we get into full professors, only about 20% of our full professors are women. That goes downhill even further when we start talking about deans and department chairs. So we have a real lack of opportunity for women to move into those leadership opportunities. In order to improve that, we need institutional support. So we're fortunate here at UC Davis to have our Women in Medicine program. I've been able to attend some national conferences to receive additional training, bring that information back, share it with my colleagues. But we need to do more. And I think starting very early in the career trajectory is the way to have the biggest impact. By the time somebody is already a full professor, that may be too late to start thinking about leadership opportunities. We need to start much earlier.
And I think going back to what I said earlier about the sponsorship by men, so sponsorship by men in leadership is critical for bringing women along in leadership and taking advantage of these opportunities that are nationwide and may not be present at one's own institution.
More and more women are applying to medical school and to scientific graduate programs. And here at UC Davis, 60% of our medical school students and almost 50% of our residency and fellowship program participants are women. Is there one final piece of advice that you would give those young women as they begin their careers?
I would say just to support one another in the process. And the friendships that I've made through my career progression, that's really probably had the most impact on my personal career trajectory and retention. Having people to support your career, to serve as a sounding board, to help you with work-life balance. So look for those friendships early on and nurture those.
Nice. Dr. Suo?
And don't forget to ask for help.
Yeah, don't be afraid to ask for help.
We all need help sometimes. And women and men often are very willing to provide that help and support when we ask for it.
I appreciate your candor and your willingness to share your perspective. So thanks to both of you, Doctors Bauman and Suo, for helping us to launch this new way of engaging our Facebook friends and followers.
Yeah,
Thank you. Please let us know what you think of this discussion and share your ideas for future Facebook Live conversations in our Facebook comments, because we're hoping to be on Facebook Live at least once a month or so. So thank you for joining us, and we hope that you'll join us for the next UC Davis Health Facebook Live.